Hello, welcome everyone. Thanks for joining us today for our virtual presentation, Vertigo Getting Back on Solid Ground. I am Bree Kimberling. I am a nurse here at NKC Health in the Wellness Department. We're so glad you joined us. So vertigo and dizziness can be really frustrating, disruptive, and even scary. And they have a real impact on your balance, your confidence, and your daily life. Today's session is designed to help you better understand what vertigo is, why it happens, and what you can do to manage it. We'll be learning how vertigo affects the balance system, exploring simple practical strategies and exercises that can help you feel steadier, reduce symptoms, and move with more confidence. So I'm pleased to introduce our speaker today, Kyle Christopher. He is a physical therapist. He earned his bachelor's degree in psychology from Oklahoma State University and completed his doctorate in physical therapy at the University of St. Mary's in 2021. He specializes in vestibular therapy, which you're probably going to learn a lot about today, dry needling, working closely with individuals experiencing dizziness, balance issues, and movement-related challenges. So Kyle will be guiding us through today's session, sharing tools you can begin using right away to help you feel better and feel more confident. So I'm going to turn it over to our presenter, Kyle.
Perfect. Thank you, Bree. As you was kind of saying, my name is Kyle. I work at the Creekwood Clinic for the hospital. We're an outpatient clinic. We see a bunch of people for physical therapy, occupational speech, and then also even some hand therapy and lymphedema training. So my specialties are vestibular, dry needling, and I actually recently got LSVT big certified, which is for Parkinson's patients. But overall, the main niche I do is vestibular or dizziness treatment, and then general orthopedic stuff. All right, so to kind of kick off, before we get too into the weeds of all the types of distance and something like this, these are we call them the 5Ds. And if you have any of these, obviously the first one, we all kind of have that a little bit. That's why we're kind of here. But if you get the dizziness with any of the other four, this is when you should probably get it, checked out or go to the emergency room. So the first one's dizziness. We're going to get into all the different types of dizziness here soon. The second one's drop attacks. That's whenever you just faint, you pass out. The third one's diplopia, is double vision. Dysarthria is the fourth one. It's trouble speaking. And the last one, trouble swallowing, dysphagia. So if you're getting any of those with the dizziness, you definitely want to get that checked out soon. So, and then the other one that a lot of people associate dizziness with, it's, if dizziness hits you out of the blue, you automatically go to the worst case scenario, like, is this a stroke? And that's why I included this. We have an acronym, it's called Be Fast. And if you have any of this with the dizziness, it is very important you kind of get it checked out. So it's sudden loss of balance, coordination, eyes get blurred, double vision, like we were talking about. The face is a good one if one side of your face just droops or you can't really smile or it feels numb. That's kind of a key sign. Arm weakness, numbness down the arm with sometimes these other symptoms. You can't really talk. It's slurred speech. It's like think of it like if a guy was inebriated and can't really like get his words out. That's the kind of slurred speech. And then the last time, it's time to call 911 if you get any of these. And here's just a little helpful diagram to kind of help with it a little bit. Okay, so on to the main thing here. So the types of dizziness. So there is actually, when people come in to see me and they say I'm dizzy, and I immediately ask them this question. Okay, so there's 3 types of dizziness. I'm going to kind of tell you each of them, and you tell me which one you have. You can have all of them, you can have one of them, or you can actually have none of them. So the first one's vertigo, and the way I like to explain this is, light room spinning, or you feel like you're spinning. The second one's lightheadedness, and then the third one is imbalance. And we're going to get into each of these as we go along. So the first one is vertigo. And kind of like what I just said, it is described as patients feel like the room is spinning around them, or you feel like you're spinning. And this can last seconds, minutes, hours, or even days. How long it lasts greatly determines the diagnosis of what's going on. And I like to put this caveat, unless you know 100% what is causing it, you should probably get it checked out. So this whole PowerPoint is just to serve as like educational. You shouldn't be like 100% diagnosed, like, oh, well, this is what was said, so shouldn't get it checked out. You should always get dizziness checked out if it's lasting for longer than like a little bit of time. So the second one is lightheadedness. This is where I kind of have to question people a little bit to kind of get them to understand what dizziness they're feeling. The way I describe it is like floating sensation in their head, or just kind of feeling like really off. They don't really feel like themselves in the head. Something's just not kind of like clicking a little bit. Patients also report feeling their head bigger than usual, or head rush feeling. The way to understand this is like, what if you get up from laying down to sitting up and you just kind of feel like that big rush? That's what we're kind of talking about. And then the wooziness or faintness. Common causes of this are cardiac issues like hypotension, which is basically whenever you change position, your blood pressure drops a little too quick, and it settles, but it takes a moment. Dehydration and anxiety are also another one that cause lightheadedness. But typically, when I ask people about this, I'm saying like, okay, if you're not spinning, are you feeling floaty in the head? Do you feel like you're going to pass out sometimes whenever you sit up? That's how I describe lightheadedness. And then the third one is imbalance. So this is the one that it's kind of hard to describe to people. A lot of people just feel, I don't know, I feel dizzy and unsteady. Well, that's what I asked them. I was like, does it feel like you're walking on a boat? Like you just can't quite get your footing, you can't walk in a straight line, or you just don't feel stable. That's the best way I know how to explain it. You can get this with vertigo or lightheadedness, or have all three of them, or just an imbalance. A very, very common cause of imbalance, just feeling like you can't really, like you're always on a boat and you just don't feel as steady as you did a couple years ago, is peripheral neuropathy. And I'm going to get into that, actually, what that is and how it affects people. Excuse me.
Kyle, we got our first question.
Perfect.
I get more off balance the longer I stand. Is this also part of vertigo?
It can be, yes. So you get more tired. I mean, you can feel more dizzy the more tired you are. Common causes when people feel vertigo or like any dizziness, it's normally whenever they feel it more when they're tired, or in the dark, or like dark lit rooms, because then you're having to rely more on your inner ear vestibular system. So it could be that, or it could be just getting a little weak in the legs and you just are kind of wobbling a bit more, which could cause you to feel more dizzy. So what is peripheral neuropathy? This is actually a pretty common thing a lot of people are going to be dealing with. A lot of people associate it with like just diabetes, and that's not true. I've seen a bunch of people that have come to me for balance issues because of neuropathy in the feet, even though they don't have diabetes. So what is it? So peripheral neuropathy it disrupts the sensory feedback, proprioception, from feet to brain, causing numbness, weakness, significant balance issues, which triples the risk of falls. So let's put that in English. So in English, that just means your feet can't really feel the ground and adjust for it, because the sensations, like me touching my hand, I can feel it. But when we get older, the sensation in our feet to be able to feel the ground and like it rubbing against it is becoming a little deadened. And that makes it kind of hard to adjust for balance if you can't feel the ground. Think of it like, how would you know the difference between walking on a concrete or on gravel or on grass? It's kind of hard to determine how you need to walk a little different if you can't feel the ground. So that's why neuropathy causes a lot of issues with imbalance. So people with this have a lot of trouble walking on compliant surfaces or soft ground like gravel or sand, or even like in the yard, things that just kind of like cause your ankle to kind of roll just a little bit. So here's the bad news about it. There's unfortunately no cure for this, but research is ongoing. The best thing you can do with this is just preventing falls with assisted devices like canes, walkers is vital, because we don't want falls. Now you can improve your balance by strengthening up the muscles in your ankles and the legs to compensate for the, the little minor changes in balance. But as far as reversing any of the like loss in sensation, that at this moment that does not exist. So let's get into the inner ear anatomy. So when you hear vestibular therapy or vestibular, we're talking about the inner ear, equilibrium specifically. And that is my niche, vestibular therapy. So hopefully you can see my cursor here. This is the eardrum. And so everything we're talking about is behind the eardrum. So this little snail little thing, this is the main thing we're talking about. It has actually got fluid in it, and it's got some even crystals in there. Some of y'all may know about the crystals. And based off the way your head turns, it moves the fluid in here that communicates with your brain via these nerves to tell you the way you're moving and to have your body and brain adjust for that movement. If you were having issues or some kind of dysfunction with this, then anytime you moved your head, it would cause like a misinformation and cause your brain to get confused and be like, what's going on? And that can cause a lot of the dizziness if there's a little bit of miscommunication between the inner ear and the brain going on. And this is just a more in-depth view of it. So if you were to like slice it open, here's what you would see. So these are the semicircular canals. This is the utricle, and then this is the little cochlea snail little thing, which is where hearing really helps to come in place. But as far as balance and equilibrium, this is what we're talking about here. So as you can see, there's these little thing called macula, and that is this. Think of it kind of like a boat rudder. So anytime the water or you turn your head and it's going to cause fluid motion to the left, it's going to cause this to go towards the left, which is going to send a signal to your brain to let you know, hey, we're turning to the left, and to compensate for that. And then these little hair things, they are actually help to sense that movement as well. So now into some of the common diagnoses that y'all may be curious about. So the most common cause of dizziness, especially in younger and older, mainly older adults, but is medication. That is by far the most common one. Now, excuse me, that doesn't that doesn't mean everything is going to be caused by medication, but your first thing you should question is, okay, I'm dizzy. Did I recently start a new medication? And maybe that could be what's going on. Sometimes it's the old adage, if you hear hooves, you think horses, not zebras. And then the second one, some of y'all may be aware of it, it's called BPPV, and that stands for benign paroxysmal position vertigo. Think of it like this. It's those crystals in the ears that we were talking about. They kind of get out of place and go where they're not supposed to, and it can cause some dizziness. Now, I got a section on this that we're going to talk about specifically. So if you're curious about this in depth, just wait just a moment and we'll get to it. Acute vestibular neuritis, that is when the nerve that connects to the inner ear gets a little inflamed, either from a virus or something like that. To give you an idea, let's go back to this one. This would be the nerve we're talking about. And unilateral vestibular hypofunction. So that is basically if one side of your ear just isn't quite working as well as the other side. The best way I know how to explain this to people is think of it like your inner ear is like a muscle. So you know how sometimes one side of your arm can be stronger than the other. Now, when that happens with the inner ear, it can cause a bit of a imbalance going on, which can cause vertigo or dizziness because your brain is confused. Why is one side working really well, but the other side's not working quite as well? My best analogy for that is think of it like an airplane with a jet engine on each side. One's working at 100% and the other one's working at like 50%. Now, obviously, this isn't how planes work, but if you were to fly straight with that going on, the plane would veer to the left and it would kind of keep veering until it just goes in a circle. That's exactly what's happening whenever we talk about one side working not just as well as the other side. And then the last one is low blood pressure. So this one's a pretty big one. That's that orthostatic hypotension I was talking about, to where you sit up and then you get really dizzy, but after you wait there, it goes away. So if you get this, it's wise just to kind of check it out with your doctor to make sure it's all good, that it's not dropping too much. And then a lot of times they're just like, just take your time whenever you transfer from like laying down to sitting or laying down to standing. Uh, Drinking water can help regulate blood pressure. So that would be the first thing you would want to do is try to increase the water uptake per your, if you have a cardiologist, you want to check with them, but always kind of get it checked out if there's blood pressure going on. Now, these are still common, but to a lesser degree. I would say anxiety, stress can cause flare ups and dizziness going on. Cardiac issues, if you have a heart problem, the heart pumps oxygen to the brain and other parts of the body. So, if you're having heart issues and your lack of oxygen, that can cause dizziness. 3PD, now that is a newer diagnosis called I may be butchering it a little bit, proximal position perception dizziness. Now, this is where you've had a vertigo incident and it has resolved, but you still feel really dizzy. So these people go in and they have like all the testing's clear. There's nothing wrong with them, but they still feel dizzy. That's because your system just kind of got thrown out of whack a little bit. And then you have to gradually increase your confidence with balance activities to get back to normal. It has kind of a component with that anxiety that I was talking about earlier. And then the last one for this one is concussion. So this is when you whack your head and it's just not going away after a couple days. And this can be a common thing we see. And then now the less common ones. So obviously, strokes don't happen quite as often as the other ones for dizziness. But obviously, if you get that dizziness feeling with like this face drooping or you have trouble talking, something like that, obviously go to the emergency room immediately. Like I said, if you don't know like 100% what's causing the dizziness, better safe than sorry. Get it checked out. Meniere's disease, that you may have heard of this one before. I would say maybe not a lot of y'all, but it gets thrown around a lot in healthcare when it comes to dizziness. It's actually a lot rarer than what's led to believe. It's a combination of a couple things. It's loss of acute hearing loss, fullness in the ear, vertigo lasting hours to days, and severe nausea. You have to have all four of those to have Meniere's disease. There is some genetic component there. So if you had a mother or someone in the family with it and you're having dizziness, you might want to get checked out for it. Labyrinthitis is where that snail little thing in the inner ear gets inflamed. It can cause hearing loss or temporary hearing loss with some dizziness being said. Bilateral peripheral vestibulopathy. Now, that is when both sides are just really not doing well. They're both working very not good. So, that is one that can cause a lot of dizziness going on. And a vestibular schwannoma, that's basically a tumor that grows in the vestibular nerve. That's super rare. I've never even seen one, and I have been doing this for 5 years. So that one, the likelihood of that happening to you is like almost slim to none. Now the vestibular migraines, these are interesting. I'm starting to see kind of more of these. I would say to where your dizziness your dizziness causes migraines. And so if you had a lot of chronic headache issues, maybe sometimes you might want to get it checked out to see if the dizziness is actually causing the migraines or if it's just something going on with the brain. Maldebarkment is actually interesting. It's a fun word, but it's whenever you get off a cruise ship, you feel kind of unsteady for a couple days, but it goes away. That's what that is. Ramsay-Hunt syndrome and Wallenberg syndrome, I won't get too much into these because they're super rare also, but they would need a physician to kind of diagnose. Those aren't straightforward, but they present with a lot of other things that would kind of give a clue that's what's going on. Okay, so how to treat these issues. We kind of learned about all the diagnosis, what kind of dizziness there is. So there are 3 forms of how you can treat it. Adaptation, which is where we do all the exercises to help the brain relearn how to basically meet that deficit, make it better to where you don't notice the deficit later on. Think of it as like doing weights or rehab for your knee that's hurting. You're strengthening the muscles. Same thing with the brain and the inner ear. You can strengthen it up to make it less dizzy. The second one's habituation. Think of it like this: the more you do something, the more your brain ignores it. My example I use for people is, you know how when you light a candle, you smell it good for the first 30 minutes, but then after that, you don't really notice it until you like leave the room and come back. You can do the same thing with your brain. You can, cause the dizziness over and over again until your brain just like gets used to it and doesn't respond as severely to the dizziness. So you don't really feel it as much. And then the third one's compensation. That's when, if it using like a cane to make sure you don't fall or a walker to make sure you don't fall, these are to make sure basically you're safe if you feel dizzy. So now on to the one that a lot of people deal with, the benign BPPV, which is those crystals in the inner ear. I would say besides medication, this is the most common diagnosis I see for people coming in to see me. It's when those crystals kind of get out of place and cause some havoc. So BPV is a medical disorder of the vestibular system characterized by repeated episodes of positional vertigo, caused by displaced otoconia, or tiny calcium carbonate crystals, from the utricle to migrate into one of the semicircular canals. So that's a lot of jargon. Let me kind of put it into normal speak. So let me go back to this thing here. Yes. So here's where all the crystals reside. We call it the utricle. And they are naturally forming, dissolving, and they are supposed to stay in here. However, you see where these little like loops things are? They're not supposed to be in here, but there's little openings into these loops. So if you get like bump your head, or by some chance you were laying on your side for too long and it just kind of crystal pops loose and falls right in there, gets in there, that's what causes this BPPV. Now, anytime you tilt your head, the crystal moves in there and it causes the vertigo, which is the room spinning. This mainly happens when you're laying down, like when you go to lay down or getting out of bed, you bend over or you look up, it causes the crystal to move in there, which causes confusion in the brain. Normally, after the room spins a couple seconds, or like about maybe under a minute, and then it's fine after that. You feel a little woozy, but they're not supposed to be in here, and that's where we're trying to get rid of them to get back to their home, to where they dissolve and it's all good. So let me go back to that. So I will say that this is very common in females over like 65, because they have found people who get this are vitamin D deficient or vitamin C deficient, to where they are like osteopenia, or bone health is a little low. Because when you think about it, the crystals are calcium carbonate, which is kind of a form of like component of bones. And so if you're having a little trouble with bone health, you might be having some trouble with the crystals, how well they're sticking to each other in the ear. So this is more prevalent with females, but it can happen to males too. The main thing, if you know that this is what's going on, is if you lay down and the room starts to spin for like under a minute, or maybe even a little over a minute. But it should not last more than 2 to 3 minutes at all. If it's doing that, it might be something else. So, oh shoot, I forgot I had this one. So this is a good visualization here. So they normally stay in here, but then when they kind of pop right over to where they're not supposed to be, they get in here. That's no good. We don't want them in here, or we don't even want them in here. So this is called canalithiasis, when they're stuck in the canal. Cupulolithiasis is when they get stuck on that little middle part, the little entrance. That is where it can last for a little over a minute. But if they're in here, the dizziness can last for a couple seconds. But what we need to do to get them back, to fix this, we need them back to loop all the way around, drop back in here to where they dissolve, and it's all good. So how do we test if we got this? So I hinted at it, but this is the actual test for it. It's called the Dix-Hallpike maneuvers. I would say you do this in bed. Always do it in bed, and if you have someone, do it with someone by you. But you just turn your head to the side about 45 degrees and lay down quickly, tilt your head back. And then if the room starts to spin, then you probably got it. And you want to count how long it spins. If it's less than a minute, it's canalithiasis. If it's more than a minute, it's probably cupulolithiasis, where it's kind of stuck. Now, that would be for the posterior canal. So this is the posterior canal, and then this would be the horizontal canal. This one is the more common one. About 85% happen here, and about 15% happen here. The anterior canal, only like less than 2% happen here. I have never seen one because they're just that rare. And then to test the horizontal canal, all you do is lay on your back and just kind of turn to the left or turn to the right. That's why when some people, they say when they roll over in bed, their room starts to spin. It's because it's probably in the horizontal canal. So to treat the one, this is the most common maneuver we do to get the crystals back where they need to be to stop the dizziness. It's called the Epley maneuver. Now this would be for the posterior canal, which is where 85% of them happen in. And this, I included a little PDF that you can click on. It'll take you how to do it for the left and right side. But essentially, as you can see here, they turn their head about 45 degrees, lay down, turn their head the opposite way, roll on their side, and then sit up. Now, here's the key that a lot of people do not do that they need to do. Whenever you lay down, you want to wait for the dizziness to stop. Wait about 30 seconds or double the time that the dizziness went, and then you turn your head to the next phase. And you want to wait again for everything to stop, wait 30 seconds after that, and then rinse and repeat every stage. And then that's what you need to do to kind of get the crystals back where they need to go. Now, this one's for the right ear. You just do the opposite to the left ear. The little PDF I have here helps you to take through both. Now, this one is for if it's just kind of being pesky, it's stuck. This is the one where it lasts for like 2 minutes and it's just horrible. This one's rough, not gonna lie. You basically turn your head for about 45 degrees. You lay down quickly and then really quick, like less than a second, whip all the way around and sit back down or back there, and then you sit back up. But you wait for the dizziness to subside every time before you move to the next phase. I would highly encourage the Epley maneuver. Not many cases require this Samant or liberatory maneuver. If you're needing this, I would probably go see a vestibulotherapist. They can help you through it. And then the horizontal canal, which is the one where you're roll to the side and you start to spin. This is the maneuver for that. So it's used for a horizontal canalithiasis. This one's a little rough. It requires you to get on your belly. Basically, you turn your head towards the side and then turn your head all the way to the right. Then you lay on your side, keep rolling to your right onto your belly, and then roll even more to your side, facing the other way, and then you sit back up. I included a little YouTube video on how to do that because obviously that's kind of hard to understand already. Now, as far as exercises, so those were if you got the crystals going on. Now I'm going to show you a couple of exercises I use for people who have dizziness, and it's not the crystals, but it's just something still kind of off. So the first one I take people a lot through is the X1 exercise. This trains your eyes. Now, this is the one I want you to focus on, to where you keep your eyes focused on the thumb that you hold out in front of you, and you just turn your head from left to right, staring at the thumb. This trains something called your vestibulo-ocular reflex. Think of it like this. It's the ability of your eyes to stay focused on something while you turn your head. If this was off, even by a little bit, it can cause dizziness anytime you try to turn your head to look at something. That's a pretty common thing I hear about. And your balance overall is comprised of 3 things: your eyes, your inner ear, and your legs, and how strong they are and adapt. So this works on the eyes component. And then you just kind of do it for about a minute. You do that a couple times. You want to try to get to around 120 beats per minute. But if you just do it for about a minute, a couple times a day, honestly, that has been helpful enough for my patients. The next one, which I really love this one, honestly, you can do this one a lot. So it's called the Romberg stance. So it's when your feet are together. And I prefer if you do this in the corner, not touching the wall, but in the corner. That way if you start to fall, it catches you. You can put the chair in front of you too for a little added security. But you put your feet together, you close your eyes, and you just try to stand as still as you can. You try to hold this for 30 seconds, perform it in the corner. If you get a little dizzy or if you sway, that's okay. Just keep doing it for the 30 seconds, and then open your eyes and rest and let for the dizziness subside. This really works your inner ear. I basically tell people it's like doing bicep curls for your inner ear. The more you do this, the better it kind of trains your inner ear, and it helps strengthen your ankles too, honestly. You can do that one like 8 to 10 times a day. Spread them out though. Don't do all of them at once. Same thing for the X1. Don't do them all of them at once. And then this one, it's a pretty simple one. If you were to grab a pen or stick your thumb out in front, you just kind of move your thumb side to side while keeping your eyes focused on it. I also included a YouTube link to how to do that. Follow along with someone that shows them. This one is another good one that if you have some inner ear dysfunction, you can do it seated, where you just kind of tilt your head up and down, or you can turn it side to side. I would start with your eyes open first, and then you can progress to eyes closed. And then if you can handle that pretty okay, I want you to try to do it standing, eyes closed, turning your head. But it would probably be best if you did it in the corner. That way you feel pretty steady, and if you start to fall, the corner catches you. So these are my references to some of the ones that had the number on it, that if you were curious about stroke symptoms or any of, there's one for the BPV. But that's what I got so far. Any questions?
As someone who has vestibular migraines and MDDS diagnosis, along with binocular vision dysfunction, are your treatments the same for both?
Could you say that one more time?
Yeah. Someone who has vestibular migraines and MDDS diagnosis, along with binocular vision dysfunction, are your treatments the same for both? So
That's a
vestibular
very good
migraines,
question.
yeah,
The
MDDS.
first, I would say, short answer, no, there's not one that fits all people. I would say if you have binocular dysfunction, you probably need to go see a neuro ophthalmologist. So they can get you glasses that kind of help with the vision component. Vestibular migraines, I actually am treating someone right now for that. I would highly encourage if you have trouble with lights, like there are some glasses that have FL41 tint that help to filter out the bright lights. And you can wear them indoors, outdoors, and that has been very helpful for some people.
Is that like blue light therapy, or is that something different?
Uh, it's something different. So blue light glasses, yeah, where it like filters out the blue light. These glasses filter out that and additional other things. So I would say you would, for vestibular migraines, you just want to work on the X1 component, but you probably also want to look at getting some of those glasses that help filter out the severe light component, and see if that helps. I've had some people say it helps a lot. And if you haven't been to a neuro ophthalmologist for the binocular dysfunction, I would probably try to set something up with them, because the eyes can have a big component to the vestibular migraines.
I'm getting several comments and questions about the PowerPoint. Yes, I will send this PowerPoint to you guys, so you'll have those links that Kyle has added for the PDFs and the YouTube videos and whatnot. Okay, you have a couple more questions. Can spinal stenosis of the neck cause vertigo?
Yes, actually, it can. Think of it like this. If you're compressing the nerves, you're kind of compressing the sensation and neural information up to the brain and to the surrounding areas. If you know for I would hope that they have gotten it checked out and that's what's going on, but I have had people with spinal stenosis of the neck cause the dizziness.
Yeah, definitely see a neurosurgeon on that one, or at least your primary care. Okay, I have been diagnosed with BPPV PPV for several years now and continue to have problems with turning my head from left to right. It causes dizziness.
Mhm.
So I need to pursue vestibular therapy again? Question mark.
I would say so. If it keeps happening, you may still have it. So you can have BPV, the crystals, and then get it resolved, but still be left with the dysfunction of their inner ear going on. So just because the crystals are gone doesn't mean that you are done working on things. You still have to do sometimes a little extra work to get your right the ship, so to speak. Do a little bit of vestibular therapy. And then also there, I found some research that if you want to help stave off, if you've had BPPV, the crystals going on, you're more prone to get them again. But they did do some research and they said if you take like vitamin D3 or vitamin C, that it can actually help to decrease the frequency these happen or the crystals get loose and happen. But if you're still having it, for sure, I would go just touch base with a vestibular therapist, get a couple exercises, make sure the crystals are where they need to be, and go from there.
So you mentioned habituation earlier. So for a
Mm-hmm.
situation like that, how long would habituation take? I mean, or is that something that would be relevant?
Yeah, so that's like the Hail Mary one. Honestly, it's not a fun one. We want to do the adaptation, but if like all else fails, habituation, you just do it enough times so your brain gets used to it.
Yeah.
A lot of that is like 2 sets of 5 or 3 sets of 5. You do the exercise like shaking the head, you stop, wait for the dizziness to settle completely, and then you do it again, and then you want to like spread it out throughout the day. Honestly, that can take anywhere from weeks to even like a couple months for the habituation to get fully there.
Okay. Sounds miserable.
It's not that's why it's not my go-to first.
Yeah. Um, barometric barometric pressure
Mhm.
changes. Is that
Yeah.
something you see often?
Oh yeah, yeah. It
So there's
in fact it's funny that's mentioned because I'm sure a lot of people from yesterday, maybe even today, are having a rough day.
yeah.
Any of my vestib people or dizzy patients or even concussion or migraine people, anytime a storm's rolling in or coming in, they're better than any weatherman out there. Their dizziness is pretty bad because think of it like this: the barometric pressure changes causes in fluid. Well, your inner ear, it has fluid in there. And so if there's changes in pressure going on, obviously it's going to affect the fluid pressure in your ear. So no, that's definitely a thing.
That makes sense. Closed eyes movement causes vertigo. Is that common?
Yes, that is basically um, there's 2 types of vestibular systems. So there's the brain and then the inner ear. A lot of times, I would say if your eyes are closed and you try to balance, or if you eyes closed and move your head, and that causes dizziness, it's most likely the inner ear component, and that's very treatable. The 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 brain components, whenever you're just sitting there and like everything's setting it off. Moving your head, moving your eyes is setting it off, and like you can't stare across the room and fixate on something without it settling. Um, but yeah, it most of the time, if you get dizzy with in the dark or eyes closed movement, it's inner ear dysfunction.
Because you did say it was the three components for your dizziness. It can be your eyes, your ears, and then your legs, right?
Yeah. Hmm.
Those things take into consideration when you think about balance. Dry needling. Do you do dry needling for vestibular issues?
If the dizziness is coming from their neck, I forgot to put that in. There's something called cervicogenic dizziness, cervicogenic headaches. So it's whenever your neck pain is just so, but like if your muscles are super tense, it's causing a lot of pulling on your head, that can cause dizziness or headaches. That is when I would do dry needling.
Okay. Great questions, guys. Keep them coming. What else you got? Like I said, you're going to get a email with this link, this recording link. That's a YouTube video. I'm going to include Kyle's slides on there, which will have the links in the slides. He had links for PDFs and YouTube videos for exercises and more information. So be looking for that. I think that's it. All right,
Cool.
Kyle, thanks so much. Thanks for sharing your knowledge. Thank you guys for attending. I hope this helped you. Where can we find out, like maybe if we want to come see you, Kyle, what do we need to do?
Yes, so if you have any questions or if you want to be seen by a vestibular therapist, you want to call the rehab services with the hospital and ask, like, hey, I've been having some dizziness. Um, can I see a vestibular therapist? Now, vestibular physical therapy is direct access in Missouri, so you don't need a physician um, script or a referral over, but sometimes it's easier if you just ask your doctor, like, hey, I would like to do some physical therapy. Can you like refer me over to like NKC Health? Or heck, it doesn't even have to be NKC Health. You just like ask your doctor, like, hey, I need some vestibular therapy. Can you send a referral for that? And if you're not comfortable with that, you can just call the place up and be like, hey, when can you get me in?
Yeah. Never underestimate the power of your patient portal by sending a message
Mm-hmm.
or leaving a message for the nurse, and just saying, hey, I saw this video. I'm thinking this might help me. And I don't think there's really going to be any physician that's going to say, no, don't do that. I don't think that's a good idea. Um, okay, what else? I will include the all those things I talked about. Also include the website, ways that you can get in contact with our rehab people. Um, Make sure that you go and check out our YouTube channel. Kyle's on there from before. He's done a couple more videos for us. And check out our webpage, nkchealth.org. More classes and events right there on front and center of the page. So I hope you guys have a great one. Thanks again, Kyle. And we'll see you all next time. Bye.